Well, she spent years helping cancer patients for a living, but when Dr. Reema Batra found out she herself had cancer, it took her life for a turn. The doctor became the patient. Dr. Batra, an oncologist at Sharp Grossmont's David and Donna Long Cancer Center, joining us now to talk more about her journey. Doctor, thanks so much for being here.
Thank you for having me.
Incredible journey. I mean, whoa, you've seen the cancer journey for so many other people, right? You've helped them through that fight, and then you found out that you had breast cancer, right? I mean, walk us through when you found that out and, you know, how we got to where you are here today.
Well, it was a very busy time of the year, December, just a couple of days before Christmas. And I was working a full day seeing patients. And I went to my usual afternoon rounds and found out that I had cancer while I was working. You know, essentially, like every cancer patient will report, my entire world fell apart in that second. And I had to pick up the pieces quickly for my family and for my patients and get myself better really quickly. Now, almost a year later, I'm doing great. I was diagnosed with stage 1. I had surgery called a lumpectomy, followed by radiation, and now I'm on a pill that I have to take for 10 years.
Wow, incredible, doctor. I mean, you were faced with your own mortality here. I mean, I would imagine that taught you a few things that medical school doesn't really quite prepare you for, right? How did that experience make you a better doctor here today?
Well, there were a lot of things that I realized during that time that I had no idea what was going on in the background with patients. You know, when you meet with patients, you discuss their treatment, prognosis, all the things that, you know, you think are important for them. But for me as a patient, I realized that I had to be thinking about my family and my children and how I was going to tell them and the anxiety that went along with my mortality. And so, you know, those are things that I use as tools now when I speak to patients. And oftentimes I will share my story with patients because I think that they can see that I'm coming from a place that only certain people can understand.
Yeah.
And it really does help them through the journey.
Yeah, you're really making a connection with them, helping them get through a tough time. Look, my mom went through breast cancer when I was a kid. I remember those difficult conversations. I mean, you have two 7-year-old twins. You had to have that difficult discussion. But what I remember is the family rallying around mom, right? And the triumph that comes from beating cancer. I mean, tell us about the experience with your family, that conversation that you had to have, and then how they've helped you along the way here.
Well, in some ways, because it was around the holidays and my twins were born actually on December 26th. So it's a very busy time of year for us. It actually did sort of distract us all a little bit for a few days. And then over time, I did explain to the twins that I needed to have surgery and that I was going to be sick for a little while. You know, they took it pretty well. They're great kids, so they took it pretty well, and they never really actually saw me getting very sick. I didn't have to get chemotherapy because I was diagnosed so early,
Right.
And so they never really saw me physically looking ill. So I think that gave them a lot of comfort. And on the flip side, they gave me a lot of comfort. I mean, kids are just great. They just bring humor. They have just such a lovely way of looking at the world. So it was easy for me to kind of just get distracted with them around.
Look, the reason that you caught it early is because of that mammogram, right? I mean, boy, how important is that? The median age for breast cancer, by the way, 62 years old. You were diagnosed at 45. I mean, you got to get in for that mammogram, right?
Oh yeah, I'm busy person. I have a full-time career. I'm a full-time mom. I have an active social life. So it was easy to want to put it off. And I have to confess, I did put it off for a month or two. But, you know, I had to make time for it. And after my story came out, I had a lot of my friends tell me that they had been putting off their mammo for many months and even years. So I'm hoping that this message gets out to people because I am so lucky that I was caught early. My prognosis is great. I didn't have to go through chemotherapy or any kind of intensive treatment. I feel wonderful. So I think getting caught early is, the best thing you can do for yourself and for your family.
And they say women at high risk should even start even younger, right? At the age of 40. So if you're in your 40s, you got to take this seriously. And thankfully for you, you caught it early.
Mm-hmm. I'm so grateful that I went for that mammogram. I had squeezed it in between a work day and a tennis match.
Yeah.
So I was kind of in a rush, but I got it done, and I'm really grateful I did it.
Well, October, of course, a big month for us to, bring awareness to cancer and everything. Any other messages you have for people that may be going through this right now? Not everyone has had an easy road with this. It has been a very difficult, cancer can be very tough on the family, but we've all got to stay positive, right? And find that inspiration in people's stories like yourself.
Yep, stay positive and, enjoy life to the fullest. That's been my lesson.
Dr. Batra, we really appreciate your time this morning, and glad to have you here. And please keep us posted as time goes on here, and say hi to those kiddos. And I know you're going to have a wonderful holidays here this season.
Thank you so much. Thank you.
Thanks for coming on the show.